Mrs. Smith, a 74-year-old regular patient of yours, is visiting today for her regular checkup and clean. She is also interested in knowing about the replacement options for a gap present between her lower left back teeth. She is medically fit and healthy. Her last visit was about 1 year ago for a scale and clean. You have done the cleaning and you noticed that there are no new cavities and the gums are healthy. Tooth 3-5 is missing and there's sufficient space for replacement, and the tooth 3-6 has a metal cap on it. Address the patient's concerns and get the possible replacement options.
The pointers here would be addressing patients' concerns first, explaining all replacement options comprehensively, positive reinforcement of oral hygiene practices, and we should also provide material for patients' reference, which will help in decision making. Alright, now let's discuss the role play. Well done, Mrs. Smith. You were quite patient with me during your checkup and clean. How are you feeling?
I'm alright, thank you. Yes, glad that was done. I'm not a big fan of cleans.
I completely understand. Now that is out of our way, I'll sit you up and let's discuss what we have done so far and my observations as well. Is that okay?
Yes, thank you.
Alright, I've had a good look at your teeth today. I'm very happy to note that there are no holes and no issues with your gums. I can see that you've put in your time to improve your oral health and I must really appreciate your efforts. You're doing such a great job maintaining them.
Thank you. I'm so glad my efforts are paying off.
That's great. Now let's address your concern about the gap in your lower left back tooth region. Can you tell me how long you've had this for?
I've probably had this gap for a few years now.
Okay.
I can't really remember when the tooth was removed. I just want to know what can be done, as I often find food packed there, and I also feel like I can't really eat much on that side.
Right. No, I completely understand. So I do see that it is in a spot where you would commonly have these issues. And yeah, I would say that replacing this gap will definitely help with eating and cleaning as well. Now, let's discuss some options and you can tell me what your preference is. Are you happy for me to go ahead with this discussion?
Yes, please.
Right. Now, you should know that there is not always a need for replacing this gap if the appearance in itself does not bother you. And you said it's been a few years since you've had this gap, right?
Yes, doctor, a few years, definitely.
Sure. So now you see the way the teeth are in this picture. I've just taken a picture for your reference to show it to you as well. So you see how they're holding onto each other quite well, and there are no untoward movements of the teeth itself. So which means this is not affecting your function as such. And at this point, if there was no other problem, we could have left it. But because you mentioned that, there's food getting packed in there and you have other concerns with it, we can now look into some options.
Yes, sure. I'd really like to know more.
Right. So the first one would be that we can place a removable plate there with the missing tooth in it. This is very relatively inexpensive. You can wear it, you can remove it, and it depends on your comfort and your need as well. It can be made out of plastic or metal, but just making sure again, are you allergic to anything?
No, doctor, I don't think so.
Okay, that's good. So that's the first option. And now we move on to the other options, which are a bit more, they're stable, they're fixed, but they are also slightly more expensive. So the fixed bridge, this is an option where you will require support from the teeth and which is adjacent to the missing space. It is slightly more expensive than the removable plate. It also does require good ongoing maintenance from your side. So there are two types in this again. We make one sort of a fixed bridge where it can just take support from just only one side of your back tooth. The other recommended option, in my opinion, would be using both the teeth adjacent to this space to take support for the missing tooth. But this means that we will have to then investigate the health of those two teeth because we need to reduce them in order for the bridge and the cap to sit on top of it. So we have to make sure that they are good enough to provide us that support. Is that all okay so far? Are you able to catch up with me?
Yes. I'm catching up. I'm almost there.
That's good. Now, I have to bring to your attention this particular metal cap that I have seen on the X-ray and also on the picture that I'm just showing it to you. The cap seems like it's been there for a while. Has it been done a little while ago?
It's been there for a while, definitely before the tooth was gone.
Right. Okay. And you've had no issues with that too so far?
Nothing at all.
That's good to hear. Yeah. On the X-ray as well, it does not look too bad to me, honestly. I wouldn't really be worried about it straight away. But if you are choosing to go with an option of having a bridge, this gap might then need to come out because I'll have to make a bridge which fits both those two teeth. Now, I cannot guarantee you that everything would be okay underneath once I take the cap off. So this is something that I can only see after we take the cap off. And if for whatever reason it has a hole or it has something else that needs to be done, we should then be able to fix that first and then place a new bridge on top of it. So this means that there could be an additional cost involved to this particular tooth. Is that okay?
Yes. Looks a little more serious than just replacing a tooth, is there?
Yeah, that's true. That is true. Some of these things always have some surprises lurking underneath them. So that's the option with the bridge. Now, there is another option which is called as an implant. This is a more definitive option, but also does involve more surgical expertise in this. So it is expensive as well and requires you to come a few times. So if you were to go with this option, I'm happy to provide you a referral because it is a surgical procedure done by a surgeon and they have their own ways of assessing the tooth and the space before they decide to go for this. So the critical point here is your bone health. So they will assess that to suit whether it is suitable for an implant or not. And once they've gone ahead with all of it and they feel like it is suitable for an implant, they will then obviously ask you to do a few more x-rays and other investigations. Once that is done, they will then inform you about how the procedure is going to be conducted and what the maintenance protocol is for it. This option, if you are going with this option, I'm happy to provide you a referral for this. Is that still okay? Are you still with us?
So that's very hazy. It sounds like a lot. I think I'll have to, go over these options again. Could you give it to me in writing?
Absolutely. So I've made up some points for you here. So this is some literature that you can take home. It's got exactly all the options that we've discussed so far. So you have a good read through it, see what suits you best and your circumstances at this point, and then you can always come back and let us know. Is that okay?
Yes, you did mention some disadvantages with the crown part, but you think I might be facing something similar to that with implants as well?
Yes, implants definitely do come with their set of pros and cons. The things that we do need to be really careful about is bone healing. Because it's a surgical procedure, while they're doing it, there can be a little bit of nerve damage. Sometimes some people experience some prolonged bleeding. Very rarely there could be jaw fractures. So again, I will give you all the data for you to have a look through, read through, and make sure that you are 100% on board with it before you make a decision. Is that okay? Are you all here so far?
Yes, I think I am today, but I will definitely read through all these notes and get back to you because I'm sure along the way I'm going to have a lot of doubts, and then folks back home are going to have some more doubts as well.
Absolutely. Yeah, there is a lot to consider in this, especially with the procedure and the finances. So these are all the options. Have a think through, and you can always get back to us with whatever suits you the best.
Thank you, definitely.
Worries.